Facing chemotherapy with strength means embarking on a courageous journey towards recovery. As you navigate this path, remember that you are not alone. Your medical team, loved ones, and a range of supportive therapies are there to guide and comfort you every step of the way. Among these therapies are medications designed to minimize side effects and keep your body strong, allowing you to focus on healing. Chemotherapy, while a powerful tool against cancer, can sometimes impact the body's natural defenses, particularly the white blood cells that fight off infections. This is where medications like G-CSF and Pegfilgrastim come in, acting as your body's cheerleaders, boosting your immune system and reducing the risk of complications. Think of these medications as your allies, working behind the scenes to ensure your body stays resilient throughout your treatment. Just like a supportive friend, they provide the extra strength you need to face each day with confidence. Understanding neutropenia is an important part of managing your health during chemotherapy. Chemotherapy works by targeting rapidly dividing cells, which includes cancer cells. However, this process can also affect other fast-growing cells in your body, like those in your bone marrow that produce white blood cells, particularly neutrophils. Neutrophils are the frontline soldiers of your immune system, fighting off infections and keeping you healthy. When chemotherapy lowers your neutrophil count, a condition called neutropenia, your body becomes more vulnerable to infections. This is why doctors closely monitor neutrophil levels during chemotherapy. Remember Sarah, a vibrant grandmother undergoing chemotherapy? Her neutrophil count dropped, making her susceptible to infections. She experienced fatigue and had to be hospitalized. This is a common concern, but thankfully, medications like G-CSF and Pegfilgrastim can help prevent and manage neutropenia, keeping your immune system strong. G-CSF, or Granulocyte Colony-Stimulating Factor, and Pegfilgrastim are medications that act like coaches for your bone marrow, encouraging it to produce more neutrophils. Think of them as white blood cell boosters. They belong to a class of drugs called colony-stimulating factors, which stimulate the growth and production of white blood cells. Both G-CSF and Pegfilgrastim are effective in reducing the risk of febrile neutropenia, a serious complication of chemotherapy characterized by fever and low neutrophil count. They work by mimicking a natural protein in your body that stimulates neutrophil production. Imagine them as messengers, delivering instructions to your bone marrow to ramp up its production of infection-fighting cells. These medications are typically given as injections, either under the skin or into a vein. Your doctor will determine the best route and schedule for you based on your individual needs and treatment plan. G-CSF, often referred to by its brand name Pegagen, is a short-acting medication that typically requires daily injections during your chemotherapy cycle. While this may sound daunting, many patients find the injections to be relatively painless. One of the main advantages of G-CSF is its rapid action. It quickly boosts neutrophil counts, often within 24 hours of the first dose. This rapid response is crucial in managing neutropenia and reducing the risk of infection, especially during the critical period after chemotherapy. However, the need for daily injections can be inconvenient for some patients. It often requires visits to the clinic or having a healthcare professional administer the injections at home. This can impact daily routines and, for some, may cause anxiety or discomfort. Pegfilgrastim, known by the brand name Neulasta, is a long-acting version of G-CSF. It's designed to stay in your system longer, typically requiring only one injection per chemotherapy cycle. This is a significant advantage for many patients, as it reduces the burden of frequent injections. Imagine receiving a single injection after each chemotherapy session, and having the peace of mind that your body is well equipped to fight off infections. This convenience factor significantly improves the quality of life for many patients undergoing chemotherapy. However, one potential drawback of Pegfilgrastim is bone pain. Some patients experience bone pain after the injection, which can range from mild to moderate in intensity. This side effect is usually temporary and can be managed with over-the-counter pain relievers. Choosing between G-CSF and Pegfilgrastim is a decision best made in collaboration with your oncologist. They will consider various factors including your individual risk of developing neutropenia, your chemotherapy regimen, your medical history, and your preferences. Open communication is key. Don't hesitate to discuss any concerns or questions you may have about either medication. Your doctor will explain the potential benefits and drawbacks of each option based on your specific situation. They can also address practical aspects, such as the frequency of injections, potential side effects, and cost considerations. Remember, your voice matters in this decision-making process. By working together, you and your doctor can develop a treatment plan that prioritizes your well-being and supports your journey towards recovery. Medications like G-CSF and Pegfilgrastim are prime examples of how medical advancements are constantly improving the lives of cancer patients. They provide crucial support to your immune system, reducing the risk of infections and allowing you to focus on healing. While the journey with chemotherapy may have its challenges, remember that you are not alone. Armed with information, support, and these supportive therapies, you can navigate this path with greater confidence and hope. Always remember to communicate openly with your healthcare team, ask questions, and share any concerns you may have. Your well-being is their priority, and together, you can make informed decisions that empower you on your road to recovery.